Good afternoon, everyone. I am Dr. Rajashekar from Ramaya Group of Hospitals. I am a consultant nephrologist uh, at Ramaya Group of Hospitals, Bangalore. So today we'll be discussing about pedal edema, which is an indicator for chronic kidney disease. So let us explore what is this pedal edema, what are its causes, and how it signifies the presence of CKD. Like it is the swelling of limbs, this pedal edema. How does it cause, or how is it formed? So basically, it is the buildup of salt water which is within the legs, which happens. Why does this pedal edema happen? Basically, because of mismatch between hydrostatic and oncotic pressures intravascularly. This excess fluid which is there within the vessels, he leaks into the interstitial space or subcutaneous space. So when this fluid leaks into the subcutaneous space, that becomes pedal edema. Basically, when it is progressing further, you can also see that development of fluid within the stomach, which is called ascites. There is fluid collection within the lungs in the pleural cavity, which is called as pleural effusion. And there are situations when there is fluid accumulation within the cavity outside the heart, which is called pericardial effusion. There are many diseases which can cause this pedal edema. One of the causes is chronic kidney disease. The other causes are chronic congestive heart failure. Again, you see there is fluid collection in the legs, in the abdomen, in the lungs. There is fluid collection in chronic liver disease, which is again seen within the legs, abdomen, and pleural cavity and pericardial cavity. So we all know, because there is the balance between hydrostatic pressure and oncotic pressure within intravascularly and interstitial space. The hydrostatic pressure within the vessels becomes higher, and the oncotic pressure outside the vessels is higher. So the hydrostatic pressure pushes the water outside from the vessels. The oncotic pressure in the interstitial spaces pulls the water towards it. This is when there is water leakage from the vessels to the interstitial space. So in chronic kidney disease, there is a speciality that the fluid also accumulates around the orbit or around the eyes, which is called periorbital edema. So because of which the patients develop this periorbital edema around the eyes, which is more commonly seen early in the mornings. And they have this pedal edema, sacral edema, all these things. Whenever the fluid accumulation is more, the symptoms might be high. They might come with breathlessness, they might come with abdominal distension and other things. Whenever there is CKD, people, they might not have clear appetite and that urge to eat. They have this loss of appetite, they have this loss of weight and other things. So what happens is, because the kidneys are not able to filter this excess salt water or this excess free water, there is this accumulation of water within the legs or in the lower limbs. And as the chronic kidney disease worsens, this pedal edema or the accumulation of fluid happens within the legs, feet, ankles, and other places, which becomes very noticeable. One more thing, what we want to tell is, like I said, there is a balance between this hydrostatic pressure and oncotic pressure. Because there is leak of protein from the kidneys, this oncotic pressure within the vessels is also less. So that is the reason the fluid leaks from the vessels into the interstitial space or elsewhere. So what do we do with this chronic kidney disease, or how do we control, or how do we prevent this formation? So somebody who is having protein leak from the kidneys, we have few special medications controlling at this autoimmune diseases leaking protein. So that would be one thing. Again, somebody who is having protein leak, they are advised to have good protein intake, which is very contrasting when chronic kidney disease comes into play. In chronic kidney disease, we don't tell them to take high protein diet. it is actually low protein diet. Again, we identify this chronic kidney disease by doing some simple investigations like creatinine or kidney number. This is where the number is high, and then we try to diagnose that somebody has chronic kidney disease. There are other investigations where we look, which are suggestive of chronic kidney disease. One would be blood urea nitrogen. We look at uric acid. We look at serum calcium level. We look at serum phosphorus level. We look at serum vitamin D level, and also serum albumin levels. Few biochemical parameters which will help us diagnose whether it is due to chronic kidney disease or any other etiology. We also look at ultrasound abdomen, chest X-rays, and other things. So how do we treat? Treating is basically because the kidneys are not to excrete this excess salt water. One, there is restriction of protein. Two, there is restriction of water, and there is restriction of salt. With this balanced low salt, low potassium, low protein diet and low fluid intake diet, that is when you can able to control this pedal edema or excess salt water. Only when you are able to drink or match your urine output, then only this excess salt water intake can be controlled. And again, we have specialized medications for that, like something like diuretics, furosemide, torsemide, which are being given to remove or pressurize the kidney to remove the excess fluid from the body. So again, these are given from lower doses, given to higher doses, and help removal or reduce the pedal edema. Again, controlling diabetes, hypertension, reducing your weight, maintaining good habits like healthy diet, vegetarian diet, healthy lifestyle prevents you from developing chronic kidney disease. So somebody who is at risk, who is diabetic, who is hypertensive, somebody who is on a non-vegetarian diet, somebody who is obese, they're all prone to have protein leak, or if not controlled earlier, they are all prone to have kidney diseases, which can cause this pedal edema. So again, somebody who is diabetic, hypertension, they need to be on follow-up, regular blood tests from their doctors, which help on controlling this pedal edema. So this is just tip of iceberg, which I've just passed it on to you people so that you identify your medical condition, take medical help as early as possible, and get back to your doctor. Thank you.